The Wellness Revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to today's program. I want to visit with you about a very common disorder that plagues a host of Americans, particularly as they age, and that's arthritis. That's inflammation of the joints. You get pain, swelling, tenderness, immobility of the joints. And there are several kinds of arthritis. The most common type of arthritis in those as we mature is osteoarthritis. That's osteo meaning bone, arthritis meaning inflammation in the joint. So osteoarthritis occurs primarily in the knees and in the hips. It can occur in other joints, but rarely so, maybe in the hands, but it's primarily in the knees and joints. And probably somewhere on the order of 15% of individuals over the age of 60, maybe more women than men for some reason, but not much difference, have osteoarthritis. And that means the cartilage in their joints, in their hips and in their knees has been worn down and they got bone on bone. And that causes a significant problem. It causes pain. It can cause swelling. You can get bloody effusions in your knee. They have to be drained. Oftentimes you go to the doctor and they'll drain out the bloody effusion, shoot you up with some cortisone, only to have the problem reoccur again over and over again. And the doctor says, well, I guess we need to do a knee replacement or we need to do a hip replacement. So this is a big problem, and that's a growing industry as the baby boomers and those right behind us are getting older. Got a lot of people that are getting joint replacement, which is unnecessary. We believe the best way to treat osteoarthritis, and that's the destruction of the cartilage in the joints, is to do stem cell therapy. And we offer that here at the Hotze Health and Wellness Center. And what we do is we extract fat, mesenchymal fat from your abdomen with a big syringe, about 10 cc's. We send that to CellTech Lab. CellTech is a lab that specializes in growing your stem cells. So when you take out the fat out of your abdomen with 10 cc's that gets spun, you get about 100,000 stem cells. Those stem cells, that isn't enough to provide treatment. So what you have to do is you have to grow those stem cells in a proper environment. And that's what CellTech does. They will grow hundreds of millions of stem cells. And they can freeze a portion of those stem cells for use at a later date, or they can freeze all the stem cells for use at a later date. It takes about 8 to 10 weeks to grow out 200 to 300 million stem cells, which will be used. And the stem cells then are injected into the joint, into the inner joint space in the knee or in the hip. And then an IV is also given with the stem cells. The stem cells are pluripotent cells, which means they can become any cell in the body. That's why they'll go to any area of the body that has been damaged, and they will morph into those cells. In the knee, the stem cells produce exosomes, which stimulate chondrocytes, which are the cells in the knee that produce cartilage. And you can give the injection, and then that will stimulate cartilage growth in the knee. And my wife, for instance, had this 4 years ago, had a problem with bloody effusion in the knee, and we injected her, and she had amazing improvement. Her knee used to knock up. She's not overweight. She's thin and trim. But her knee, I don't know why. She just developed the problem in her knee. And so we injected the stem cells and the exosomes into that knee, which are the byproducts of the stem cells. And she hadn't had a problem since in that knee, which is really remarkable. And we've done the stem cell therapy on numerous people in the hips and in the joints and have had remarkable results. I have one friend of mine who's 78 and he had a knee that he could hardly walk on. He came in and I gave him, we pulled his stem cells out. 10 weeks later, we injected it into the knee. And he called me up that afternoon. He said, Hotze, can it work that fast? It doesn't hurt at all. It's anti-inflammatory. The stem cells are anti-inflammatory, as are the exosomes, which are the chemical substances peptides, proteins, and other chemicals that are produced by the stem cells, and they stimulate cartilage production. They're also anti-inflammatory. And so and that was 2 months ago, and he's had a great result in that knee because his doctor, he was going to have knee surgery. He was going to have a knee replacement. So osteoarthritis is a common occurrence in people as they age, and it occurs primarily in those that are overweight. Obviously, your weight-bearing joints are going to be the ones that wear down the quickest. So if you're carrying around excess body weight, and 70% of you are overweight, half of you are obese, 35 to 40%, half of the people are overweight or obese, that puts wear and tear on your body that it doesn't need to have. If you're 50 or 100 pounds overweight, that's wearing down your joints. The most important thing you can do to help prevent developing osteoarthritis is get yourself down to an ideal body weight. If you have problems, we can always do the stem cell therapy, and I'd highly recommend that. It's not inexpensive, but let me tell you what, it's not inexpensive getting a knee replacement. You have co-insurance paying on that, and about a third of them end up having complications. I've got a friend of mine who's had his knee. He's had 3 separate surgeries. He got infected. Finally, they had to put in another knee, and people complained that it's not quite the right length, and it takes 3 or 4 months to recover from knee surgery or hip surgery. It's not an easy process. That's why it makes more sense to me to do something natural. Take your own stem cells and inject those. Some other causes of arthritis are rheumatoid arthritis, which is caused by it's really autoimmune disease, and it affects numerous joints simultaneously, particularly in the hands. You'll see some elderly people may get gnarled hands, and that's from rheumatoid arthritis. And it can be severe, and you see it primarily in the hand joints, but it will affect any joint in the body. Of course, injury, you could have injured yourself in a sport event, running. Maybe you're a runner. I personally don't believe God made us to run on concrete every day 3 to 4 miles. I believe the best way to promote cardiovascular health is not to run necessarily. I'd use a bike. You can bike in place. You can swim. A lot of things. You can walk. All these things, but that constant wear and tear on your knees. From jogging, I know numerous people that have jogged for years, and boy, they end up getting knee problems, and they get shin splints, and a host of arthritic, a host of orthopedic problems as they age, and there's no sense in doing that. And I know some of you love the high you get when you run 3 or 4 miles. You get the runner's high. I got over that back in med school, so I don't mess with that. I do jump rope, though, for about 3 to 5 minutes a day, and that's what I do to get my exercise. But you can ride bicycles or swim or a number of other things you can do. So injury can cause it. There's gouty arthritis, and that's where you get a buildup of uric acid in your blood. You can get psoriatic arthritis, not common, but people that have psoriasis, which is an inflammatory disease of the skin, they get psoriatic arthritis. Poor eating habits. Remember, arthritis is inflammation in the joint, which causes the swelling, the pain, and the tenderness. What can cause inflammation in our body is poor eating habits. People that eat a high, simple carbohydrate diet. They eat a lot of wheats, they eat a lot of grain products, corn, potatoes, and rice. All those convert to sugar. Sugar is highly inflammatory, not only in the coronary arteries and in your arteries of your body, leading to inflammation and coronary artery disease, but also it affects the joints. It causes inflammation in the joints. Interestingly enough, there's a type of plant called nightshades. That would be potatoes, tomatoes, peppers, eggplant. These are nightshades. And there are certain substances in the nightshades that in some individuals cause them to have arthritis. People can have food allergies. I mean, the common foods, wheat, corn, egg, milk, yeast, or soybean are the big sick, but any food theoretically can cause joint pain. And if you're having joint pain, it's important to be tested for food allergies, and we do that here at the center. Another thing that often goes overlooked, and we've seen such good results, is the evaluation of hormone decline and imbalance. So we see people with low thyroid symptoms that have arthritis, and they take thyroid, and it helps resolve the arthritic symptoms, because when you have low thyroid, you tend to make a mucin, a substance that gets in the skin and it gets in the joints, and it thickens the joints and causes pain. So thyroid in and of itself has been, in some cases, proven to relieve the symptoms and relieve the arthritic problems that people have. Not only that, but your hormones, testosterone and natural progesterone, both have been shown to improve arthritic conditions. When a person has their hormones out of balance, a female particularly, progesterone helps reabsorb the fluid that is caused by estrogen dominance. And in many women, we've seen just with using progesterone, they've had significant resolution of their arthritic problems. So, and it's interesting. Some people say, well, I get my joint pain when the weather changes. Well, it's true. When you get low pressure, you've got a low pressure system in the atmosphere, your joints will swell because you've got a certain pressure in your body and it swells. And if you've got some of the other problems caused by either hormonal imbalance or poor eating habits or food allergies, that change in pressure is what causes the joints to swell at that time. So, the conventional approach is commonly just take anti-inflammatories. I give you anything from steroids to ibuprofen. Ibuprofen is very dangerous. Ibuprofen stimulates coronary artery disease. It causes inflammation in the arteries. I do not recommend ibuprofen. That would be Aleve or Advil or any of the things that has ibuprofen. If you look on the bottle, it says one of the side effects of this medication is coronary artery disease. Why do you want to do something when you could do something natural to treat that? If you have to use anything, just use plain old-fashioned aspirin, for crying out loud. Don't use Tylenol. Tylenol isn't a good anti-inflammatory. Besides, it's highly toxic on the liver. So we'd recommend coming in for a full evaluation and see if the hormone therapy would help with that. We can help you find out if you have food allergies. We can see if your hormones, if thyroid and your either male or female sex hormone addition and balancing those would help correct the arthritis. And we check you, see if you have gouty arthritis, check you, see if you have osteoarthritis, and we can treat you with stem cells. By the way, we do have a product that we use to help promote joint comfort. And guess what? We named it Joint Comfort. And it's important to put the proper molecules in your body that will help stimulate healing in the joint. Glucosamine and chondroitin both are needed for the production of collagen in your cells, in your joints. It contains MSM, which is methylsulfonyl methane, and this is very important for building good, healthy connective tissue in the bones. Bromelain and Braswella are both good anti-inflammatories, and they are contained in Joint Comfort. I take that every day. I'll tell you, I don't have any joint pain. I'm 73. Would I have joint pain if I didn't take this? I don't know, but I've been taking it for 15 years, and it's helped my joints. So, and some other things that are very important is magnesium can be very important in joint pain, because when your magnesium's out of balance, that can adversely affect your calcium levels, and you can have some problems going on in your joints that magnesium may help improve. Also, make sure you take good fish oil. You'll get the your essential omega fatty acids that your body needs to keep the joints lubricated naturally. So, if you're having a problem with joint pain and you have problems with, your energy's low, you're not thinking clearly, you have difficulty with weight, you have cold sensitivity, you can't focus and concentrate, you have mood swings, You got brain fog, memory loss. Your memory's not good anymore, not as sharp as it used to be. You get joint and muscle aches and pains, constipated. You get loss of the lateral third of your eyebrows, thickened tongue. These can all be signs. And if you're a woman, if you have difficulty with your periods or infertility, these all often are signs and symptoms of low thyroid. And that can be an issue with joint pain, and it may be one of the measures that can be taken by providing you with some supplemental thyroid to help you get your metabolism up and help your body function as it should. So if you're having problems with any of these symptoms, including the joint pain, then you can give us a call here at the Hotze Health and Wellness Center, or you can call Physician's Preference Vitamin Store, known as also go to Hotze Vitamins, and talk to one of our nutritionists, certified nutritionists there, and talk about what they might recommend to be able to help you strengthen your joints. I do want to offer you the book, Hormones, Health, and Happiness. I will offer you that free of charge. We'll ship it to you free of charge. I want you to have this because I want you to know how to get yourself on a path to health and wellness naturally. So as you mature, you have energy, you've got vitality, and you got enthusiasm for life. I'm Dr. Steve Hotze, and I want to thank you for joining us today. And please let us know if we can be of service to you. God bless you now.
At Physician's Preference Pharmacy, we believe that personalized medical treatment and customized medications are the best way to help you achieve your healthcare goals. Sometimes this requires adjusting the dosage form of the medication from something like an oral capsule to a tablet which dissolves underneath the tongue. This is called a sublingual tablet. Sub meaning under, lingual meaning tongue, under the tongue. And there are several reasons why your doctor may want your medications to be custom made into a sublingual tablet. Perhaps you have trouble swallowing capsules or difficulty absorbing medications. With sublingual tablets, you still get the treatment you need in a way that is effective for you. Tablets made here at Physician's Preference Pharmacy are designed to dissolve fully under the tongue in just a few minutes and offer an additional option for you to achieve your healthcare goals.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.